Hi, welcome to the DRH show where I have wide-ranging conversations with interesting people. We talk about all things psychology, mental health, and wellness. Today, I'm joined by a clinical psychologist, Dr. Nina Silander. Thanks for joining me.
Yes, it's my pleasure to be here with you.
It's great to have you here, Dr. Silander. So if you could just share to us your background, your trajectory in life, and how you ended up doing what you're doing.
Yes, absolutely. Well, I suppose to start with, I grew up primarily in Europe and in very multicultural settings before returning to the United States during my adolescence. And I went on to university, or as it would be here, college, and studied psychology, fine arts, and political science in a liberal arts college, which was sort of the foundation of my education. And from there, decided that clinical psychology would be my best trajectory in terms of a career. And so from there, went on to my graduate education to pursue my doctoral degree in clinical psychology. And also, you know, it was interesting having had the background I did during my university years, where I ended up continuing to study political science in a smaller capacity, but that has remained an interest of mine, both in terms of research and personally.
Well, we'll explore more about your area of specialization and also your research interests in relation to clinical psychology. But I understand, Dr. Silander, that you also feel strongly about ideological bias within clinical practice. If you could just talk us through about the sequence of events that led to this.
Yes, it's been an interesting journey. So it was around 2015 that I finished my courses with my graduate program and had just completed my dissertation, which happened to be on a more feminist topic. And around that time, I was also a campus representative for Division 35 of the APA, which was essentially the Society for the Psychology of Women, and was promoting a lot of feminist content. And just around that time that I was closing out that chapter of my life, I started reading Who Stole Feminism by Christina Hoff Sommers, and thus began a rapid descent into like shifting my worldview. And I began reading a lot of content, researching a lot, and suddenly had the impression that a lot of what I had believed to be true really was much more dubious than I had originally thought. So for instance, when I was reading Who Stole Feminism, I had learned that there was some research about how school-age girls' self-esteem was really quite a problem, and this required large-scale intervention, but it was really based on a very flawed or misrepresented review of the research findings, but it resulted in about $360 billion worth of funding for further research and program changes. And I can't help but think maybe that has had some bearing into why boys and men are underperforming in education now. But all to say, it was sort of during that time that I was also noticing more and more like bias creeping into professional settings. Like I was attending professional conferences, and keynote speakers would make jokes about politically conservative people, for instance. And I personally was kind of shocked and thought that was very unprofessional, whereas other people in the audience were sort of murmuring and laughing a little bit. And I just noticed more and more problems like that. And so it kind of resulted in me really like wanting to study and understand this better and what the implications were for my profession as well.
I understand when you said that some people make fun about conservative views, because I've actually experienced that myself. If I share, I was at a conference in Malaysia about I think 2 or 3 years ago. I can't really remember.
Yeah.
And one of the keynote speakers, she is. It just sounds really cringy. She just said that she's British. And she said, "On behalf of my country, I apologize for." It really sounds cringy.
Yes, it does.
It's a big psychological society, and so when they opened the floor for questions, and I actually kind of I pick up on what she said. I said, "It really sounds like we're bordering towards politics now." I don't really care about your idea of colonization and slavery, but when we just talk about psychology, especially in this gathering. But what I want to hear from you, Dr. Silander, is that some people who would be watching this interview, what they would, they would say that what you actually call as ideological bias, as feminist ideas, they would simply say that this is actually just an opportunity to highlight the role of identity within clinical practice. And of course, when we're dealing with of human narratives, of lived experience, we can't really, disentangle this within clinical practice. So what do you make of that?
If I understand you correctly, you're asking essentially, how do we separate out, just understandable differences among people from something that's more political? I think that's a very difficult question to answer. I think, and I suppose one way I could answer that is, as clinical psychologists, as mental health professionals, I think we have a shared ethics where we are taught not to imbue our political persuasions or attitudes on the people we work with, let's say. But then we see, for instance, in certain guidelines of professional practice that we are almost directed to address certain things with people we work with, like their privilege status. And so that seems like a contradiction. Like we're not supposed to be political or promote our own political perspective on the one hand, but on the other, like told to do something like that. And I think it's because for many in our profession, they don't recognize that certain things are political, like to talk about privilege, to I guess that's probably the best example, but I could describe other ones too that have to do with ethnic and racial issues, for instance. And it's really encouraging people to be political, I think, without them even realizing that these are things that are contested or can be seen or viewed differently.
Now, let's be more specific. More recently, you wrote an article for PsychReg where you said that there's an ideological bias evident in the APA conference. We're talking about the virtual conference held last year. So if you could just expand on this observation.
The theme of that the APA is the American Psychological Association, and it is the largest and most important professional psychology organization in the United States. And every year they have an annual conference, and of course this past year it was virtual, what with the pandemic. And the theme of the conference was to look at the current events of the year, and specifically how psychology as a profession could be a leader in response to some of those big national or global issues. And I think we would probably all agree that one of the thematic problems, at least in the United States and over the course of the summer, were the protests and sort of racial unrest following, certain events like the death of George Floyd. And with that, sort of the response and reaction to law enforcement, the criticism and even some violence as well as attacks on public and private property. And it certainly was on the news frequently over the course of the last summer. And so in my mind, at least, I thought, of course, like there's a strong ethnic and racial discussion to be had, but also, this is a very difficult time for law enforcement. We already know that they're often less likely to go seek mental health services and do experience higher rates of certain problems like depression and PTSD, sleep difficulties, and suicidal ideation. And so it would make sense, for the APA to at least provide some attention towards the needs of law enforcement. But they had a handful of live sessions, quite a few of them, and none of them focused any attention on law enforcement or first responders. And it really stood out to me as, kind of an obvious blind spot when it was all said and done.
Now, I understand, Dr. Silander, that you actually gave a CNN interview about how to speak to people with, we disagree. Now, obviously, in a perfect world, there would be lots of disagreements. If you could just tell us what your actually tips on how to address disagreements.
Yes, that interview took place just prior to the 2020 presidential elections, which was a timely opportunity for that kind of discussion. And I think, I fall short of this, I think, in my personal life too at times, but the idea of really being able to have theory of mind, essentially to recognize and understand that people can see things from a different point of view and that there's a reason for that, and something to be understood thoughtfully is very helpful. We certainly have our life experiences and our educations and all kinds of factors that go into why we see things differently. And when we're interacting with other people, it's very important that we really, first and foremost, appraise and value the relationships we have with those people and sort of uphold that as more important than a disagreement about something political. And, as I say that, it feels obvious, and yet I think more and more so over time we see people having falling outs with not just, coworkers or friends, but also family members. And that's very sad. And I think that's unique during this time.
Absolutely. And on top of the interview with CNN, I understand you also wrote an article in a book chapter about ideological bias. So was this a research article?
Yes. So during 2015 and in the years after that, when I was really experiencing sort of a shift in my perspective, I had reached out to other people who maybe had similar concerns that I did. One of those was a professor and a social psychologist at Rutgers University, Lee Jussum, who studies stereotype accuracy, which is a contentious and maybe unpopular thing to study, but a valuable one. And also Robert Mather, who's a professor and social or experimental psychologist at University of Central Oklahoma. And he studies automaticity, and they both kind of served in different ways as sort of informal mentors and guides to me at different points in that journey. But as I was going through my training, I was accruing a lot of information and had a strong desire to put that towards a manuscript for publication, because I was seeing that there was a lot of bias in social sciences and social psychology, and I was seeing manifestations of that in my training in education and supervision and interactions with peers. And I wanted to sort of connect the dots in terms of what this means for clinical practice. And to my knowledge, it was really one of the first publications about this, specifically about this, and in quite a few years as well. And so it was a big step, and I kind of joked with some of my my closest friends, like, I'm concerned that this might like jeopardize my career. Like, maybe I won't be able to work as a psychologist after this, because it felt risky. And so much so that even a good friend and colleague of mine, like, initially wanted to participate on the project, but decided not to because she was concerned that if she did, it would maybe interfere with her employment opportunities and thus jeopardize her work visa status as an immigrant. So yeah, but essentially it was looking at like what the bias in the literature could look like in clinical practice, and that was that initial article.
It's really kind of worrying that, you know, when you're just expressing your what you think should be how we do clinical practice, it kind of, you know, jeopardize your profession. But more than that, I think we also have to talk about how this, you know, ideology really affects clinical practice.
Yes, absolutely. So I think one example would be the concept of symbolic racism, which I think is a more subtle construct in social psychology that emerges in clinical practice in different ways. And essentially, symbolic racism is the concept that, like, we don't really see explicit racism anymore, but racism still manifests in other subtle ways through, for example, preference for certain policies that maybe are typically more conservative in nature, for instance, affirmative action. So to be opposed to affirmative action would be an example of symbolic racism, because it's perceived as something that would limit opportunities for ethnic or racial minorities. But it really misunderstands sort of the genuine concern that maybe someone would have about affirmative action, which is inherently a race-based policy, and one that does maybe have even debatable, but nonetheless debatable ramifications for the people it's intended to help. So that would be like one example. Another example may be sort of the devaluing of individual responsibility because it's perceived to be victim blaming, which I think is extremely unfortunate. And one would think we could sort of navigate a finer line of acknowledging that sometimes, you know, we experience things in life that are unfortunate or unjust, but nonetheless, like, to sort of deny the responsibility one has at an individual level, or the idea of internal locus of control, is really like crushing, I think, to individual people. And it also is sort of a contradiction in the research, because on the one hand, we're told that, like, there's the myth of meritocracy, and yet on the other hand, there's researchers like Angela Duckworth who study grit, which is a wonderful thing, but it's like, we can't say that grit is wonderful on the one hand, but meritocracy is a myth on the other. I think those things are sort of opposed and not really reconciled, but would be an example of like things that are maybe problematic when it comes to providing like psychotherapy, for instance.
Mm-hmm. And do you have any theory on as to how this political ideology creep into the clinical practice, the psychotherapeutic process?
Yeah, I think those would be examples, but maybe in addition to that too, I remember hearing a psychologist describe to me, hearing someone, I think a client of hers, express frustration over people using food stamps, which is maybe an unfortunate comment to have made, but she perceived that as a racist one, even when the person himself didn't say anything about the ethnic or racial identity of those who were using food stamps, let's say. And so I think the concern is sort of conflating certain socio-political viewpoints with prejudicial or racist attitudes is a problem, because at best it's maybe a misunderstanding, but at worst it's really seeing someone as morally corrupt or even maybe psychopathological, because some people do wonder, is racism really a mental condition or disorder? And to really have potentially that degree of misunderstanding is, I think, a concern, and it could be a threat to the therapeutic relationship.
But I suppose the question here is that how you, as a clinical psychologist, how would you kind of apply your pre-existing knowledge, your multicultural competency to prevent the detrimental impact of ideology? How would you do that?
Yes. So one example would be, psychologists are trained to be self-reflective, and I think, generally speaking, psychologists are relatively compassionate. It goes by virtue of the territory in terms of wanting to help people with their problems. But I think in the same way that we approach multicultural competence and humility with regard to an array of other diversity factors like age, disability status, sexual identity, let's say, we can do the same when it comes to socio-cultural political values. Even very similarly with how we do with spirituality or religiosity, which really pertain to the worldview in which we experience our lives and relationships and purpose. And to really foster that as a clinical skill set is a helpful thing. I also find that reflecting on the work of Jonathan Haidt and his moral foundations is a helpful strategy too, because it indicates that we have the same fundamental values, undergirding the way we approach social issues, but simply the differences are in how we weight these values, and that can be what leads to differences in perspective that are not well understood until we really look at those underlying principles and values and the way that those are weighted. So I think that kind of approach can be very helpful. Also, to not feel personally threatened by a client's perspective or political persuasion, because I think sometimes it can register on a more emotional level. And then on a different note as well, the Heterodox Academy, while the resources are not specific to, say, clinical practice, the educational content available there, I think, can lend itself well nonetheless in terms of really fostering regard for other people and respect and genuine, sincere interest in other perspectives.
Mm-hmm. And would you say that psychology or the mental health profession has become a sort of activism, a sort of a movement? Would you say that?
Absolutely. And when I was in my graduate training, I had also participated in that, even very directly, by joining with one of the professional psychology organizations, the Society for the study of psychological issues, social psychological issues, SPSSI, and one summer had gone to Washington, D.C., our nation's capital, and participated in this like 1 or 2 day workshops where we went and lobbied Congress according to, or at least to promote a certain policy, and using psychological science towards that end. And it was a very exciting and unique experience. And for that, I was grateful. But truly, like in the years after, I started to regret that, because I think it's one thing to present psychological research and science and say, this is what we know based on this data. And it's another to say, and with that, we want this policy or this law, because ultimately, like, we don't have the background in economics or public policy or law or even philosophy to really, at the professional level, say, like, we need this policy versus a different one. And I think that is a place where psychologists can run amiss in terms of, like, maybe becoming something beyond scientists. And with science, we need to be objective, to look at the data and not have a particular investment in a certain set of findings. But with activism, you're going into it with a particular agenda or purpose and using what you can towards that end. And I think those two approaches are fundamentally incompatible.
And of course, it's good that we're actually talking about this, because it makes people realize that we're not actually comfortable with this, whether as a client or as a practitioner. But of course, it's one thing talking, but it's another thing having a sort of a collective action. And you mentioned earlier that there's some heterodox academy. So are there any other organizations that you're aware of that sort of, promoting an ideological free kind of psychology?
Oh, I'm not sure, to be honest with you. I mean, the Heterodox Academy is the obvious one. And then there's the relatively new organization called FAIR. And I apologize, I don't remember what it stands for, but essentially is looking at racism and discrimination, but using a lens apart from critical theory, which is really powerful, essentially going back to the fundamental principles that even Martin Luther King Jr. applied. And granted, that is not specific to psychology, but I think we're seeing more of this counter movement in response to a very strong sort of ideological movement that is starting to lose more and more people.
And of course, there's CTA, the critical therapy antidote, although it's not mainly for psychology, it's also for the therapeutic practice, CTA. So that's the politics bit. So let's move on to psychology. So if you could just tell us about your role as a clinical psychologist. So what's your area of specialization?
Yes. So my graduate training was specifically in clinical psychology, and I went on to complete my doctoral fellowship in clinical health psychology, and that happened to take place in a level 1 trauma center, which I don't know how it looks different maybe in the UK, but in the United States, essentially that is an acute care hospital that receives patients who've experienced the worst or most critical physical injuries. And that's where I worked in the trauma surgery department. And I have since taken a position and I'm working as a rehabilitation psychologist, where I see patients who are experiencing acute and chronic medical conditions that usually are involving some temporary or permanent change in functionality. So spinal cord injury, brain injury, stroke, amputation, for instance, and I provide a combination of inpatient and outpatient assessment and psychotherapy services in that context.
And of course, I understand that there's a lot of dynamics involved when it comes to loss and trauma. But as a clinical psychologist, can you just tell us some of coping skills that people who've experienced loss and trauma can implement in their lives?
Yes. There's a few things that I frequently find myself returning to when I'm speaking with people in the clinical context. And one of those things is I actually reference often Viktor Frankl and his logotherapy, which I don't know if you're familiar, but the sort of essence of his approach is to ensure identification of meaning or purpose in the midst of adverse circumstances. And that was based on his own life experience as a Holocaust survivor. And I think regardless of the severity of our circumstances or exactly what the nature is, having something from which we can ascribe purpose or meaning, especially when it transcends our immediate circumstances, is extremely valuable and important. So that would be one thing. Another is when it comes to anxiety and post-traumatic stress, as difficult as it is, I am constantly cautioning people, don't avoid the things that cause fear because it makes it worse. So avoid the avoidance. That is the single most important thing in my opinion, but it is really the thing that I've seen change for most people when they're experiencing a lot of emotional distress that is fear related. Similarly, I think it's valuable to find a balance between being honest with oneself about the intense and difficult emotions one is experiencing or the circumstances, and to really have a firm grasp on if there is something to be feared, what is the worst case scenario, what is the biggest thing that's causing stress, and face that head on and be honest with oneself about what it is. But then on the other hand, to also acknowledge the power of a good reframe. And what I mean by that is when we're most distressed or upset, it's easy to think about things through those blue-colored lenses, seeing something as very negative. But when we can put a reframe on something, and not necessarily to see it as entirely positive, but to find a more balanced or even truthful perspective about the situation that accounts for all factors, is really helpful and is very useful in terms of promoting resilience and the potential for post-traumatic growth as well.
Now, Dr. Silander, a lot of people who would be watching this are actually young people or students. So do you have any tips or advice on how to be a good clinical psychologist, or can you share some good qualities of a good clinical psychologist?
Yeah, there's a few things that come to mind. One is for those who are maybe still in their training and education, I cannot emphasize enough how important it is to really have a firm grasp of statistics and being able to read research well, even if you're not conducting it personally. I think a lot of people choose psychology in part because maybe they don't like mathematics very much. It's difficult. It's not very fun for people who are maybe more geared towards the humanities, but it's really important to know research well so that you can sort of identify strong research from maybe more politically influenced research, or identify evidence-based interventions versus pseudoscientific ones. And so, yeah, I think that's a really important thing. I also remember that some of the best marital advice I ever heard was before marriage, keep your eyes wide open, and after marriage, keep them half closed. However, when it comes to entering the profession of psychology, I recommend keeping them wide open the entire time because there's a lot that's going on. You want to understand not only like where ideological bias is sneaking into the picture, but also be prepared to be an active participant in writing the course, maybe where it goes off track, and to speak up in those situations that may be very pivotal. I think as well, when it comes to interacting on an individual level with people and in services, it's valuable to really make sure you connect with people on a human level, rather than viewing people solely as case studies or in such a clinical fashion that we sort of lose sight of our shared humanity. And I think we can convey that in our tone of voice, our mannerisms, if and when and how we disclose information about ourselves and things like that.
And who inspires you both professionally and personally?
That's a good question. I think the types of people who maybe inspire me most are not necessarily the ones with whom I agree on everything, but are the ones who, like public figures such as Ayaan Hirsi Ali, John McWhorter, Thomas Sowell, Christina Hoff Sommers, Jordan Peterson, even, who to the best of their ability try to say the things that they believe are approximating objective truth as much as possible, even when it's not popular or puts them under the spotlight of public criticism. That can be quite harsh as well. I appreciate that we have intellectuals like that who can offer sort of a different perspective and is just immensely valuable.
And of course, you've been a psychologist for quite some time, so I'm quite sure that you've come across a number of misconceptions about clinical psychology. So if you could identify those misconceptions and sort of address them.
It's funny that this is one of the questions, because just recently I started reading the 50 greatest myths of popular psychology by the late Scott Lilienfeld, and it covers a range of different topics, like, the idea that people are either left or right-brained is a very popular myth. That's a useful resource. This is aside from psychology, but Sally Satel's work on the myths in healthcare disparities is also, or health disparities in general, is also very useful. But in terms of clinical psychology, I think, the idea that like a clinical psychologist is always like diagnosing someone or peering into the recesses of someone's mind is really not the case. I mean, if I'm not being paid to do it, I'm not diagnosing someone, unless maybe they're doing something extremely standout, or out of the ordinary, but and only in my mind as well. But I think maybe like a myth that I sometimes run into, it is like, especially from ancillary professionals like those in medicine, they think that what psychologists do is sort of magical, like they don't really understand it. We kind of make people change in some way, but it's not clear exactly how that was achieved. And I think, the reality is that we have different theoretical models for, why people are the way that they are and how they make decisions. And we really just come alongside of people to facilitate meaningful change in their lives.
And I suppose I also have to mention this about clinical psychology. We're both doing clinical psychology.
Yes.
I'm doing a PhD
Wonderful.
in clinical psychology, but we have different take on clinical psychology because you're a practitioner, whereas I'm not going to be a clinical practitioner.
Yes.
I know it's not within my interest and my ability. But I suppose I think that's one thing about clinical psychology. It's a misconception that when you have a background in clinical psychology, you will always be a practitioner.
That's
but
true.
Thank you for highlighting those misconceptions. Now,
and, similarly too, some people think that they will go on to do a particular thing with their career, but even from graduate training onwards, your career can take many turns, and it's very difficult to predict that. But you're right, like not everyone who goes into clinical psychology will become a practitioner. Many will go into research too.
Yeah, yes. or even a blogger. It reminds me of, I was invited on a career talk last December. And basically the title of my talk is, I did a degree in psychology to be a blogger. And I won't trade what I do as a blogger to being a practitioner, because I enjoy creating digital content. And I'm just there talking about there's actually a career in being a content creator. So that's another avenue that you could explore when you have a psychology degree. But of course, just like what you said, you don't have to resort to pop psychology. It's good to have a good grounding in statistics. But another thing I want to ask you, Dr. Silander, is what's the most important thing you want the public to know about the work that you do, whether, trying to discourage people from, falling into the temptation of ideological bias, or just being, an effective clinical psychologist. So what's the big message?
I think the big message is especially intended for well-meaning, reasonable-minded psychologists who may not realize the extent to which ideology and politics is influencing our profession. And to combat that, it's extremely important that we're mindful of, connecting the dots between certain political movements and the research concepts that we're using and what we're saying to people when we're working with them in the clinical context. I think it's very easy to sort of conflate these things, to conflate a political attitude or policy position with racism, for instance. And it's really important to be able to step back from that and be cognizant of one's own worldview perspective as well, and to really recognize what someone else's is, not just what, like the caricature of it, but what it truly is, and to approach that with a sincere and genuine interest.
And of course, it's a bank holiday today. You should be relaxing. So thank you for taking the time to join me today. But how do you relax? What's your distressing outlet?
I spend a lot of time outside when I can. I enjoy quality time with my loved ones, and traveling if and when that'll be an option again. And when the time permits for it, I really enjoy getting back into my art as well.
And what do you think you would be doing if you didn't work as a clinical psychologist?
One time when I was interviewing for graduate programs, those are often group interviews, or at least some of them are. And I remember sitting around a table with other applicants, and, everyone is anxious and quiet. And I ended up, trying to loosen people up with conversation and ask them, okay, like, if you weren't here trying to become a clinical psychologist, what would be your alternative career? And I think, like, if I could, like, being a traveling food and wine critic would maybe be ideal.
I'd love that. Yeah.
Yeah.
And finally, what else is in the pipeline? And if people wanted to reach out to you, what platforms can they get in touch with you at?
Coming in the pipeline now, there's one book chapter that I worked on with a colleague, Dr. Anthony Tereskovich from John Carroll University. And that was looking specifically at the threat of ideological bias to the American Psychological Association specifically. The book is Political Bias in Psychology. And for those who are interested to find it, the editors are, Craig Frisbee, William O'Donoghue, Richard Redding, and the late Scott Lilienfeld. And that's in press currently. It will be the most comprehensive text on this topic to date. So it will be certainly worth looking into. Similarly, those of us who are associated with the CTA network, we're working on another book project, which will specifically look at sort of the effect of critical theory and the problem of it in the therapeutic milieu. And I have a slew of other writing projects that I am really looking forward to getting to when the time permits. So those would be the things to be on the lookout for.
Brilliant. Dr. Nina Silander, it's a pleasure having you here on the DRH show, and I look forward to hearing more about your work. Thank you.
Thank you so much.